In October 2023, Masai Giraffe Matu sustained a broken toe on his hind left foot. As you might imagine, caring for a foot issue on a giraffe is no easy task. So how do you treat a Masai giraffe with a broken toe? Step 1. Training.
Long before Matu's injury, his wildlife care team began familiarizing Matu with the tamer. A tamer, Giraffe Restraint Device, GRD, is a padded hallway with doors to access different parts of the giraffe.
Here's Matu at under a year old entering the GRD. Slowly over time, he became more comfortable and training sessions were more frequent and longer in length.
He also learned that tasty treats awaited him when he voluntarily entered the tamer.
Eventually, he would fully enter and enjoy some tasty kale before the chute doors would open for him to pass through. The trusting relationship he has developed with his keepers since he was born has proven invaluable in his training process. The GRD is crucial both for his safety and for the safety of the team treating him, which is why this behavior is a key ingredient for his healing success. Step 2. Quality care and expertise. As a result of the incredible training and trust between Matu and the wildlife carekeepers, standing sedation treatment began immediately, along with 3 times a day training sessions to best care for this 11-foot-tall patient. During these procedures, Matu enters the GRD where he is positioned with belly straps to help support him if needed. He is given a very light sedative and then his leg is raised into a position that is comfortable for him and safe for the team to work. His dressing was taken off and the team inspected the injury site for comparison to previous exams. A tourniquet was then placed near his ankle and a local anesthetic and an antibiotic were given, providing pain relief while his toe was being worked on and a highly localized antibiotic therapy. Whilst his perfusion is working, Matu stood in a foot bath of Epsom salt and iodine. Then the tourniquet is removed, the bath drained, and his foot is raised again into a position where we could gently clean the wound. Finally, his foot was redressed with his very own special giraffe booty to protect his toe and ensure it remained clean until it was time to repeat the entire process, and an ice pack was applied as well. Most recently, Matu no longer requires his booty as he is spending more time out in the giraffe habitat, which is a significant step for Matu's journey. In these photos, you can see the growth between early December and January. Keepers are still doing 2 to 3 training sessions a day in the GRD as they continue to monitor his progress closely now that he is boot-free. Matu's toe may always require extra care and attention so that his toe has a more normal appearance, but more importantly, his gait and overall well-being appear unaffected by the injury. While we are still not out of the woods quite yet, the wildlife care team is excited about this step in Matu's recovery. Being able to do this was and is life-saving for Matu. A giraffe cannot live on 3 legs, and giraffe general anesthesia is an extremely high risk. Thanks to the GRD and exemplary teamwork, we have been able to care for Matu as his injury heals and are excited to see him make a full recovery.
Good boy. Yeah.